Welcome to this session on vasovagal maneuvers. By the end of this session, you should be able to understand what vasovagal maneuvers are and why they are performed. You should also be able to list different types of vasovagal maneuvers and describe them in detail. You should also be able to list examples of scenarios where they may be helpful and understand possible contraindications or risk factors to consider before vasovagal maneuvers can be performed. Vasovagal maneuvers are simple yet powerful techniques that stimulate the vagus nerve to help slow the heart rate or restore a normal rhythm. They are particularly useful in managing rapid atrial fibrillation, atrial flutter, or SVTs in general. These maneuvers are frequently used in both emergency and outpatient settings because they offer a cost-effective, drug-free alternative when trying to treat or manage tachyarrhythmias. While vasovagal maneuvers are generally safe and effective, it's important to emphasize proper technique to minimize risks. Patients should be educated on how to perform these maneuvers at home and understand when to seek medical attention. For clinical settings, supervision by a healthcare provider is often recommended, especially in patients that are unstable or for diagnostic purposes. The most common vasovagal maneuver is the Valsalva maneuver. It is also referred to as bearing down. This technique involves forcefully exhaling against a closed airway, such as by pinching the nose and closing the mouth while blowing out. This action increases intrathoracic pressure, which stimulates the vagus nerve. This technique is often used by patients at home to manage paroxysmal tachyarrhythmias or SVTs, as it is the most accessible technique. A variation to the Valsalva maneuver is the modified Valsalva maneuver, which is more structured and includes postural adjustments. For example, the patient performs the maneuver in a semi-recumbent position for 15 seconds, then lies supine immediately afterwards with their legs raised at a 45-degree angle for another 15 seconds. This can be repeated as necessary. Research shows that this variation is more effective than the standard technique when trying to terminate SVTs. The carotid massage involves gently massaging the carotid sinus in the neck to stimulate baroreceptors and trigger vagal tone. This technique must only be performed by a physician. As a cardiology technologist, you may be expected to record a rhythm strip or document when a carotid massage is being performed by a physician. This technique comes with risks, especially in patients with a history of stroke, TIA, or significant plaque buildup in the carotid arteries. This is because performing a carotid massage may dislodge plaques, leading to a stroke. Physicians will often auscultate the carotid sinuses before performing this technique. Lastly, there's the diving reflex. Immersing the face in cold water or applying a cold pack to the face can activate this natural reflex, leading to a slowing of the heart rate through vagal stimulation. However, this technique is not commonly used in the clinical setting. The modified Valsalva maneuver is more effective than the standard Valsalva maneuver because it includes which of the following? A. Forced exhalation on a closed airway. B. Postural changes. C. Immersion of the face in cold water. Or D. The use of medications. The correct answer is B, postural changes. Recall that the modified Valsalva maneuver employs the standard Valsalva maneuver with postural changes. The patient performs the standard Valsalva maneuver in a semi-recumbent position for 15 seconds, then lies supine immediately afterwards with their legs raised at a 45-degree angle for another 15 seconds. This can be repeated as necessary until the SVT is terminated.